Morning. Thank you for having me.
Dr. Marlin, as this month shines the spotlight on men's health, are men doing enough to take care of their physical and mental health?
No, the short answer is no. And some of the reasons you have already alluded to, what we don't know won't hurt us. I'm scared to find out. Maybe it'll go away on its own. I look fine, I feel fine, therefore I probably am fine. And the problem with all those reasons is that by the time a diagnosis is made, especially with regard to things like cancer, it's usually a little too late. And if only men will come forward, and even seeing it with the vaccine, the uptake among men is slower compared to our female counterparts. So for those reasons, it's important that men take their health seriously and early enough.
How often should men get an annual physical exam, such as including blood pressure and height and weight checks, prostate cancer, etc.?
Yeah, so the answer to that depends really on age and risk. So in other words, if the, testicular cancer, for instance, is a cancer of younger men, usually below the age of 40. And in that case, men must be taught how to examine their testes or their scrotum to get a feel for their testes so that they can pick up anything abnormal. At least once in their 20s and 30s, their blood pressure should be checked, height and weight checked, blood glucose and cholesterol. Things like colorectal cancer and prostate cancer are diseases usually of the older men, so from their 40s upwards. That's when you should have a regular checkup to measure your prostate count, to have your stool sent off for a stool sample to check for blood with regard to those cancers. Obviously, if there's diabetes in the family, more regularly, if you're severely overweight, more regularly, and if there are particular cancers that are rife in your family, you need more regular checkups.
Men often have more difficulty handling stress than women. Why is this, and how do we begin to tackle this?
Yeah, so that's a difficult one, and it's always challenging to diagnose a mental health condition in men. And I think part of it is because, we try to be the stoic ones, we try to be the strong ones, and I try and explain to my patients that being diagnosed with something like anxiety or depression is not a character flaw. It's no reflection on you. It's no reflection on your character, even your faith or anything like that. It's a condition. It's something that we are all susceptible to. And the real courage comes in acknowledging it, facing it, dealing with it, and then accepting treatment for it. And so there's always a stigma attached to having a diagnosis of a mental health condition, that we must be weak, we can't handle things, it's going to be a bad reflection on with my employer or with my family, etc. So it's important. These things do happen. We live in a society where mental health condition is extremely common, but help is available, and we should be more accepting of that.
So, Dr. Marlin, how does family history and lifestyle put one at risk?
So a good example with this, with that, it will be something like diabetes. If diabetes is in your family, coupled with being overweight and not exercising enough, so if you have a sedentary lifestyle, you automatically have a much higher risk of becoming diabetic within your lifetime, purely because it is already in your family. For instance, with breast cancer in females or prostate cancer, if a family member, especially on the paternal side, has had prostate cancer or colorectal cancer, you immediately are at higher risk. And therefore, you need to have more regular checkups. You need to listen to your body, look out for any signs of change. Family history of heart disease, Desiree, for instance. If someone has had a heart attack or stroke in your family, you are immediately at risk, purely because there's nothing you can do about it. It's in the genes, it's in your family line. You can change your weight, you can change everything else, but you cannot change who has already had a heart attack in your family. Therefore, you have to be much more healthier than someone who does not have a family history.
And unfortunately, negative attitudes and beliefs towards men who have a mental health condition are common. How do we overcome and educate people about this stigma?
Yeah, so again, what we are saying is anybody is at risk. It can happen to anybody. The real courage, the real strong man are those who face it, who deal with it, and then go, if necessary, going on to medication. Do you know how difficult it is to get a man to accept that he needs counseling? Immediately, why do I need to see somebody? I don't need to see a shrink. I'm not crazy. And all these words get thrown around irresponsibly. So it is not a negative thing to be diagnosed with a mental health condition. It is common. It is becoming more and more common. But let's face it, let's deal with it, and let's name the name. Let's talk about anxiety disorders. Let's talk about major depressive disorders. Medication is available, help is available, and many of these conditions can be cured so that you don't have to live with a mental health illness for the rest of your life.
Yeah. Now, do communities have local and national groups that offer local programs and internet resources, for argument's sake, that help reduce stigma?
Yes, there are many available, and there are many that deal with it in a compassionate, empathetic way, in a way that protects your privacy and protects your confidentiality. Many of these can be dealt with in a kind, compassionate way via telephone or via internet or whatever a social media platform is available. There are many brochures and resources that are available. So there's no reason for anybody to struggle with any of these conditions alone and without assistance. And as I said, you can protect your privacy and even your identity. But please reach out to somebody and get help, because there's plenty of help available. It can be done in a way in which you can benefit and get healed of your condition.
Let's thank you for talking to us. A very important conversation. I was Dr. Marlin Mckay talking to us about Men's Awareness Month, which shines the spotlight on men's health.